The Community Health Foundation was founded by Linda Muxin Sesay, a practicing nurse who is domiciled in Maryland, United States of America. The objective is to improve healthcare system in the country. Professor Alpha Tijanwuri, the Minister of Health and Sanitation, said that the coming of the COVID-19 has led to a seismic shift in the mindset of Sierra Leoneans. As he said, massive support coming from people home and abroad is a clear sign to show that we are slowly moving towards self-reliance. Professor Wuri noted that the Muxin family has always demonstrated their resolve to nation building. He assured all that this current administration is committed in investing in the healthcare system in the country.
You know, we are witnessing a major change in Sierra Leone. We are really witnessing self-reliance among our own people. Yes. During the Ebola scourge, we had people from every part of the world coming to give us support. This time, I don't want to say we are on our own, but for most of the time we have to think and do things by ourselves. And it has created a major change in this country for people to make effort to do things by themselves. The Muxin family have demonstrated that by even thinking of creating the Canadian College of Technology at Mile 91. I never thought they would have a tertiary institution, but it was good to know and see it grow regularly. And now, my lady Linda demonstrates that they are a family that wants to give back, a family that wants to support this country. ICU beds are critical, are vital. We have only one ICU, full-fledged ICU unit in the country at Connaught Hospital.
Dr. Bashtaki, the Deputy Chief Medical Officer, when speaking, said these equipments couldn't have come sooner. As he said, the long-standing problem that has always plagued the medical community has been lack of intensive care beds for patients. Dr. Taki added that at a time like this, intensive care beds, whether manual or electrical, is desperately needed, especially for patients who are displaying extreme signs and symptoms.
Intensive care is extremely important at a time like this, and you could see for most of the list we've sent out to people to make contributions to the government and also for the government to buy things. Top of that list has been intensive care beds, whether manual or electrical. And so to be here receiving 40 of those, when we now know that even transporting, you could buy them, but transporting them to Sierra Leone becomes a huge task.
Dr. Ibrahim Tholi is a consultant and member of the foundation, said that Linda Muxin's ambition is to give back to Sierra Leone. As he said, even though she resides in the United States of America, but her dream is to come back home to lend her expertise to the country.
Well, some investments are very profitable. And an example of a profitable investment is that of Linda. She is very determined. She left here, now she has qualified as a nurse, and not only qualified, she's determined to come back home. And this is what she has started doing, forming a foundation that will give back to the country where she came from, especially at a time when we need most of these things most. When you have good children, those who are good always know how the father thinks, how the father feels, what the family feels. And this is one of the children that now feel that Sierra Leone needs to be helped.
For Star TV News, Alfie Barry reporting.